Hi there, I'm Dr. Kelly Clarke, and today I would like to talk about the difference between ADHD and autism, ASD. I've done many autism assessments through the years, and I have been a bit surprised and wanted to give, and certainly during and before an assessment, I will clarify what autism is. Often I would like to do, and I do, screening tools with parents to make sure that we are looking at what they think is autism in it through a clear lens. In other words, it seems to me that that parents concerned about their child's behavior will come in and be concerned that they might have ASD, autism spectrum disorder, and so I will provide some screening tools. And if they are high and elevated, then that sounds like we should probably proceed on with an assessment. But there will sometimes be this confusion between ADHD, attention deficit hyperactivity disorder, and autism. And indeed, they do mask some of the symptoms together. So I wanted to talk a little bit about that today, just to give you a little bit more insight in case you are considering of having an assessment for your child or yourself, if you're an adolescent or an adult, because certainly these can be confusing for adolescents and adults as well. So for ADHD, probably a lot of you know that ADHD is broken into three different types. There's the attention deficit hyperactivity disorder is an umbrella term with three different subtypes. There's the inattentive type. These are folks that have difficulties paying attention, concentrating, they're forgetful, they lose things, they have difficulties with organization, sustaining mental effort, they avoid tasks that require sustained mental effort, etc. Then there's the impulsive hyperactive type. These are folks that have difficulties with interrupting people while they're speaking, impatient. They're very impatient while waiting their turn in lines. They talk excessively. They tend to fidget, squirm around their seat, restless, constantly on the go, moving, lots of movement. In fact, a lot of people are probably more familiar with the hyperactive type. That's the type we typically observe more in kids and adolescents and adults. We notice it more than the inattentive type, because the inattentive type can be sitting in the classroom or, in school and university and just daydreaming, but they're not hyperactive moving around. So there's the inattentive type where they more focus with concentration, paying attention, forgetfulness, and the hyperactive type, which is more clear and easy to see. Then there's the combined type where the inattentive and the hyperactive impulsive type are combined. Now, it is clearly a neurodevelopmental disorder. In other words, there is something going on as far as the brain's development. For example, the ADHD brain is usually what we suspect is there is a difficulty with the production of neurotransmitters responsible for paying attention. So that affects things like attention, concentration, impulse control, behavior in the classroom. With the autistic child, adolescent, adult, this is more characteristic of difficulties with social interactions, social communication, sensory experiences, sensory processing, and as well repetitive and stereotype behaviors. So we'll see those kind of characteristics. So often when say, for example, a child is having difficulties in school, they can't sit still, they're chewing on their clothes, so it seems like it's sensory, it is sensory, there's an overlap there. Parents will wonder, is this autism? They're having difficulties socially, which is one of the ones I just said, social interactions. And now what's clearly different with kids with ADHD is it is more about difficulties regulating attention and impulse control. Whereas with autism, it's more they're having difficulties with understanding and interacting or participating in social relationships. So they have difficulties more understanding these relationships, where the ADHD child, adolescent, is having difficulties managing their attention and impulse control, which is leading to behavioral difficulties. So even though there might be an overlap, the ADHD kid goes into a set of kids and he's struggling because he's so full of energy, or she's so full of energy that other kids are getting annoyed and frustrated, or they're blurting in on their conversations or interrupting these conversations, creating difficulties socially. The autistic child would more have difficulties because they don't know when So they might interrupt and blurt, but they don't know the timing because they struggle with the social complexities. They have difficulties with that approach and interaction behavior that is typical. How do you say hello and greet people? Which is a social interaction, social communication skill. Eye contact. Also, how do I respond and say things back to people? This is not typically the challenge with the ADHD kid. The ADHD child, adolescent, adult is having difficulties with regulating impulse control, creating some difficulties socially. Whereas for the autistic kid, child, adolescent, adult, it's more of a difficulty understanding the to and fro, the back and forth, understanding the social interactions, the kind of the unwritten rules in a social setting. And so they'll have difficulties with that. So those are some of the overlap in some of the behaviors, but we need to understand it's coming from a different place. Even though autism is also a neurodevelopmental disorder, the difficulties are more around social interaction, social communication, and sensory processing or repetitive behaviors. So, but they can also seem to have difficulties with distractibility, executive functioning, sensory sensitivity, which is common with ADHD, social challenges, as I mentioned, feeling overwhelmed in situations. Again, the child with an adolescent with ADHD is feeling overwhelmed because they can't focus, whereas the child with autism is struggling with emotional regulation because they're struggling with understanding other people's and their own emotions or what they mean and how to interact. So very different motivation, which seems to reflect different behaviors. We'll also see with children with ADHD that they'll be biting their clothes, chewing on their nails, and so we'll see those repetitive stereotype behaviors with autistic children as well, and adolescents. But they're more interested in the sensory. They're more, and they get lost in that. Whereas for the ADHD child, adolescent, adult, they have excessive energy and they're restless, which is contributing to those behaviors. So it's really about seeing the difference in what's motivating the behavior, what's creating the challenges. And with ADHD and autism, it's very different. The other challenge is that children and adolescents and adults who have autism, 50% of the time are diagnosed with ADHD. So now you have this confluence of behaviors, and what we really do need to do is really notice, is there difficulties with social interaction, social communication, and with stereotype behaviors and sensory processing. So, and those should be observed before the age of 3. And, things like, not having the same interest in peers, difficulties making friends, interest in friendships, these kind of things. Whereas the ADHD child does have interest, does want to make friends, is interested, but because of the impulse control, hyperactivity, it creates some difficulties, sustaining, maintaining friendships. So we can see that there are clear differences motivating or contributing to those challenges. And it's a struggle for both of them, but it's really important for proper diagnosis because, for example, with the child, adolescent, adult with ADHD, we would treat the condition differently. In other words, for the classic and most efficacious treatment for ADHD is psychopharmacological intervention. So medication is still the best treatment. There are other ways, of course, of dealing with ADHD treatment, managing the environment, self-regulation, self-monitoring, understanding, that I actually am talking too much or interrupting while they're people are speaking. Whereas with the child that's autistic, proper diagnosis is important to help them develop kind of some social interaction skills to help alleviate and address some of that difficult emotional problems that they would experience struggling with understanding and relating to their peers, and also in helping to reduce and or express their sensory needs and repetitive behaviors in different ways that's more beneficial to them. So it's very important that we get a proper diagnosis, a proper understanding of what's going on, so that there is a more effective treatment for both of these conditions. So for more information, feel free to consult me at drkellyclarke.com. Thanks for your time.